They finally failed 10 years ago. For this state college professor in Los Angeles who had grown up dirt poor in the South and finally made it, the doctor's words were devastating.
I kind of went into shock and went numb because I was in my early 30s, and he's telling me you're not going to be able to work anymore to take care of yourself.
No job meant no insurance. No insurance, no operation. To qualify for public assistance, she actually had to become poor again.
I had to spend all of my money in order to be able to get that help from the county.
Eventually, she qualified for Medicare and got a kidney transplant. But even those who pay can face risks, such as medical mistakes. In Indianapolis last month, tiny Thursday Dawn Jeffries and 2 other premature babies died after they were accidentally given 1,000 times the prescribed dosage of a blood thinner.
I think it was wrong. My baby was fine before they gave her the heparin.
It's not just patients. Doctors also say the system is broken. In some parts of this country, it is hard to even find someone to deliver a baby. It's considered a high-risk specialty.
Obviously, you know that we're not delivering babies anymore.
In northern New Jersey, Dr. Ruth Schultz has delivered close to 3,000 babies. Last year, she stopped because the cost of malpractice insurance is so high and the money insurance companies pay for each delivery is so low.
There's a lot of sadness in the fact that we're giving up something that we truly love doing. And there's nothing in the world like delivering a baby.
Yet another symptom of a healthcare system many believe is in desperate need of an overhaul.
If spending money on healthcare made people healthy, we'd be the healthiest nation in the world. And the fact is our health statistics are abysmal compared to some of the other countries that we compete with.
No easy answers here. ABC News division-wide special coverage of the healthcare issue continues all day tomorrow, beginning on Good Morning America. Our editorial partner, USA Today, kicks off its coverage in the morning, and of course you can see our reports anytime on our website.
We are going to look at health care in America. It is one of the most important policy and political issues we have as a nation. Americans spend more than $6,100 a year on health care for every man, woman, and child in the country. The average in other industrialized nations is $2,500. We pay almost 2.5 times as much, and yet people in 18 other nations live longer, healthier lives. We pay more, we get less. So what are the implications of this? We start with ABC's Bill Weir.
It is a system that too often adds financial insult to injury.
My fluffy girl, my gorgeous.
California's Nazaretian family is learning this the harshest possible way. After Nadine gave birth to premature twins, a year's worth of expensive claims came back denied. Blue Shield says they failed to disclose a prior miscarriage. The family says their agent never asked. They now owe $500,000 and are desperate to find care for their disabled little girls.
It's just killing us. We already sold some furniture out of our baby room to survive. I know the next step is losing our home.
Hospital bills are now a leading cause of personal bankruptcy. The uninsured will run a $27 billion tab this year, and those costs are passed on to everyone else. We are all paying for the sick who cannot pay in the form of higher insurance bills. The price of a family plan has doubled in just the past 7 years to around $11,000. And that is a heavy number for the likes of Casey Martindale, a trucker, father, and diabetic from Ogden, Utah.
So you're making $13 or $50 an hour?
Yeah.
This is almost 40% of your gross pay.
Yeah.
Just in insurance.
Just insurance to protect me and my family.
After working a full shift, Casey and his wife clean the warehouse for extra cash while their kids wait in the car. His boss gave him the extra work because this small company can't afford to increase benefits.
If we were to pay all of the health care insurance costs, it would be a significant percentage of our profits. We just can't do that if we want to stay open.
Have you ever denied yourself coverage?
Well, I deny myself medication at times. I should take an asthma medicine twice a day. I only take it once a day, and in the wintertime, I don't take it at all.
He is not alone. Our poll found that last year, 28% of all Americans and nearly half of all mothers put off care for themselves or their families due to cost. This creates a vicious cycle because those who skip checkups are much more likely to end up in emergency rooms, the most expensive brand of care. The ER may be the last resort for Chicago's Mary Barron.
This is my sister Irene, is a breast cancer survivor.
With cancer in her family and troubling symptoms, she desperately needs a colonoscopy, but too sick to work and too young for Medicare. She is on a 13-month waiting list for a free test.
But you do know that early detection is key.
Yes, that I know.
But you have no choice.
I have no choice but to wait, you know. That's the thing, you know, it's the waiting, it's more stress on you, you know.
But despite a shattered system full of pain and worry, our poll found 89% of Americans satisfied with the quality of their own care, and nearly 60% content with cost. It is a mindset that makes sweeping change so difficult to prescribe, an attitude that keeps national health far below the national wealth. Bill Weir, ABC News, New York.
And our week-long series, Prescription.
You know, for $1 mil, for we property owners, to pay for health care for these types of individuals, or these individuals with these types of problems, we pay $1 mil and we solve that problem for them. You know, Flint, Genesee County, and all the little cities around here and villages